I-edit out ko to, baka maibash ako.
What's up you guys, welcome back to my channel. If you are new to my channel, please don't forget to subscribe, turn on that notification bell for you to get updated for all my future uploads. By the way, my name is Raymond, your Pinoy nurse here in Ireland. Okay team, what's up? Hello. This is another episode of our series Nurse in Action, wherein I put the spotlight on nurses who are working here in Ireland to share their experiences and of course to give you an idea how is it working here in Ireland. Today we are going to feature Gastro-Surgical ward. So, without further ado, let's begin.
Alright guys, so we are back and we are joined by one of the surgical nurses here in Ireland. So I have here Mr. Remos Wally Urquico. Hi Remos, kumusta?
Hello Raymond, how are you?
I'm doing good. Napaka-formal mo naman, sir.
Siyempre, vlog mo to, kailangan medyo medyo formal tayo ng konti, alam mo?
So kumusta? Wala kang duty ngayon?
No, I'm off until tomorrow because I did 3 long days over the weekend, so...
Okay, so that's good. So, brief introduction lang, Remos, about yourself, tapos kung saan ka sa Pilipinas, and anything you can add on.
So, my name is Remos Wally Urquico, but you can call me Remos, but sometimes they're calling me Wally. kahit ano doon. Anyway, originally, of course, I'm from the Philippines. Then I worked as a surgical nurse for almost 3 years in the Philippines. And after that, I flew all the way in Abu Dhabi for, I think that's 4 years. I suppose 4 years.
So 7
then
years
after
in
that,
total.
For a total of 7 years. So after that, I decided to try my luck here in Ireland. I'm working in one of the HSC hospital in Dublin as a surgical nurse. So to be specific, colorectal surgery.
Okay, but
so
still under surgery ward pa rin siya.
Because in our hospital we have 4 or 5 surgery ward. So meron kaming ortho, meron kaming colorectal, vascular, and spinal unit. So nasa colorectal ako. So we're dealing most of the time sa mga stoma.
Okay, that's good. And just to let you know, yung mga subscribers natin, we're not gonna mention the name of the facility to give respect dun sa GDPR na tinatawag. And syempre, ayaw namin makot tayo, diba, Remos? Just wanna ask, when did you arrive here in Ireland?
I arrived last year, October 14. I started my adaptation last October 14 with you.
Oh!
Yes.
Magka-batch kami guys. Sa hospital namin. And yeah, last year you arrived and 1 year na tayo dito, just imagine.
Shout out kay Ma'am Arlene. Hi, Ma'am Arlene.
Hi, Ma'am Arlene. If you're watching this video, hello po. Ang pag-uusapan kasi natin is all about the surgical ward. Ito kasing ginagawa natin, this is part of Nurse in Action. So I give the spotlight din sa mga nurses dito sa Ireland, specifically sa different wards, para mabigyan natin ng information yung mga aspiring nurses and yung mga nurses na nasa Pilipinas or wherever part of the world. So pag-usapan natin yung surgical ward. Tell me, what is the typical day of your duty? For example, long day ka or night duty ka?
Ang pasok is usually 7:30. So dapat 7:30 na sa hospital ka na. Kasi sa ward namin, sa colorectal, we're doing group handover or panel handover. Meaning, nasa isang room kami, lahat ng mga staff nurse ng duty ng morning na yon at saka mga CNMs, mga staff facilitator nandun. And then yung mga night duty, doon sila mag-handover lahat ng mga significant event na nangyari sa pasyente at saka yung mga dapat na handover. So I think that's around 7:30 to 8 o'clock.
Yes.
And then after that,
how many patients you're handling?
Because
usually?
30 minutes. We're dealing with I think 7 patients per day, 6 to 7 patients as much as possible.
Ikaw lang yun, hawak mo lang yun.
Depende yan kung ilan yung mga census namin. Kasi sa amin may team 1, team 2 eh. So yung team 1 namin composed of 2 nurses, yung team 2 composed of 3 nurses. Kasi sa team 2 meron kaming mga side rooms, yung mga private room, infectious, mga VRE, MRSA.
You mentioned earlier about this conference, no? Parang endorsement, di ba? Yung group endorsement. Usually, what are the things that you're asking? Kasi parang bilis no? Kung marami kang patient.
Meron kaming handover, Raymond, meron kaming handover sheet. Naka-mention na lahat yung mga yung case ng pasyente, anong operation ginawa sa kanya, tapos ano yung mga, kung meron ba siyang mga antibiotic, BRE or MRSA positive pa siya, yung mga
Okay.
significant event, kung
Significant
na-transfuse ba
lang.
siya ng blood.
I see.
Tapos yun lang, babasahin lang ng nurse yun, and then eventually after that, sasabihin niya yung EWS ng pasyente.
Ano yung
Tapos,
EWS? Just to let them know.
EWS is
Early.
yung parang vital signs.
Okay.
Yung vital
You
signs
score.
ng pasyente.
Yan.
Yeah, new score, yeah.
Yes,
Composed
okay.
of ng mga blood pressure, temperature, SpO2. Example, kung nag-temp spike pa yung pasyente, ano bang ginawa? So, dapat i-hand over mo yun para at least
Aware din.
alam ng nurse kung anong nangyari sa pasyente at saka alam niya kung ano yung gagawin niya next. Kung
Okay.
ipa-follow up na ba yung mga blood result, ganyan.
That's
And then
good.
you have to hand over also the blood results of the patient.
You're sending, phlebotomist kayo, no? Pag magte-take ng blood samples, or you can also take it?
Actually, nagtitake kami ng mga blood samples kapag PIC line tsaka CDC. Kung may mga stat order at tsaka mga tawag dito, kung di ma-insert di makaka-extract ng blood yung phlebotomist. Minsan, yun nga, o ginagawa namin, ganyan.
Yeah, anyway, we have certain training para sa venipuncture.
Yeah.
Diba? And by the way, regarding the allocation of duties, so sino ba nag-allocate sa inyo? Or was it the night CNM or the morning CNM? Usually.
Actually, we don't have night CNMs. We only have day CNMs. Yeah, CNM1 and CNM2.
Okay.
So most of the time CNM2 yung gumagawa ng allocation namin. Kung wala yung CNM2, of course, CNM1 will do that. After na handover, yun nga, sasabihin na sa amin kung ano yung mga rooms namin, and then after that, we will go to the nursing station. If you will ask something, further questions, you can approach the previous nurse the nurse from the night duty, para lang for clarification. Ganyan ginagawa namin para wala lang ma-miss, alam mo yun.
Ma-miss. Tama naman.
Minsan kasi alam mo Raymond, kapag si panel handover or group handover, minsan nararattle kayo. Ako nangyayari sa akin yun kasi nga
okay.
meron kang tatlong CNMs, tapos meron mga 10 staff nurses, including yung mga student nurse at saka yung mga healthcare assistant siguro. Siyempre minsan sa sobrang kabang mo, nakakaligtaan mo na yun, di ba? Kaya ako minsan ginagawa ko, yun nga, na-approach ko na lang yung morning na duty, tapos sasabihin ko, I forgot to mention this, so ganyan na lang.
Tama naman. And actually that happens maski nga mag-individual endorsement, di ba? Medyo parang minsan may nakakalimutan ka talaga. But once you remember it, syempre sinasabi mo din right away. So usually, ano ba mga cases? Nagbigay ka na ng pahapyaw kanina about stoma. And what are other cases you handled, actually?
Of course, number one, we have the Hartman's procedure. Meron din kaming hemicolectomy. We're din also with the cancer patients.
And then, was that a cancer patient? Yes.
HIPEC.
Yes.
Itong HIPEC na to, if you know HIPEC, I think, alam mo naman
chemotherapy din. Kasi
post-operatively pupunta sa HDU yan, di ba?
Yes.
Yung sa HIPEC. So, ginagawa nila dito, para pahapyaw lang, para alam nila, ginagawa nila dito, parang sa theater, pinapasok nila yung chemotherapy directly sa peritoneal cavity.
That's correct, yeah.
Then post-operatively pupunta ng HDU yan, and then after that pupunta sa amin yan kapag stable.
Pag stable na.
Stable na yung pasyente. And then meron din naman kaming mga appendectomy, cholecystectomy, lahat ng mga abdominal surgery. And saka minsan namimix din kami ng mga gynae cases like tabso.
Yeah, kasi minsan, di ba, some parts of the gastrointestinal medyo naapektuhan din during that procedure. I just want to ask regarding the COVID response. Alam mo naman, di ba, hindi lang yung hospital natin ang naapektuhan nitong COVID na to. So what are the responses na ginawa ng ward mo? Only the things that you can share.
Yung ward namin, gusto nila maging safe from the COVID. Kasi nga, di ba, post-operative yung mga pasyente namin, so they're susceptible for infection. Kasi yung mga ibang surgery ward ginawa ng mga yung iba nag-close kasi nga ang dami nilang cases sa loob na yun. So natitira na lang is yung ward namin tsaka mga 2 wards pa ata. Yun nga, nag-start na kami nag-wear ng mask, proper hygiene, proper hand washing. Once nag-temp spike yung pasyente, ura-urada, kinokontak namin yung mga COVID yung mga COVID doctors, just to make sure. So ginagawa nila is kino-COVID swab na. Kung talagang kailangan talaga, gagawin namin is na-transfer na namin yung pasyente agad sa mga COVID ward. And
Yeah.
then, kapag nag-negative sila, babalik na lang namin ulit sila sa ward.
I see. And you know what, guys? Itong sinasabi ni Remos, I'm pretty sure sa ibang hospital, they have their own policies and protocols. So we are not generalizing the process here about the COVID responses. But I hope you don't mind me asking, Remos, but were you infected by the virus? Nagka-COVID ka ba? If you don't mind me asking.
Actually, yes, nagka-COVID ako nung May. So night duty ako noon, 7 nights ako kasi kapag night duty, we're doing 7 nights. So siguro dahil na-compromise na ako nung 7 nights.
Pagod na.
Napagod na.
So lahat kayo na in contact, pinaswab lahat? O ikaw lang?
Kami lahat. Naging nurse niya nag-positive from night duty, from the morning duty.
Iba din talaga yung COVID. So what happened? Hospital ka ba natin? Minanage or saka dinala?
Pumunta ako sa A&E. Yun nga, sinabi ko sa kanila yung manifestation, yung symptoms. Pula yung katawan mo, tapos high fever. Kasi hindi ko na talaga kaya, sakit ng katawan ko. Parang mahihimatay ako noon eh.
Okay,
Tapos dinala ako sa COVID response unit, tapos doon ako sinwab. Actually, sabi naman ng doctor, well ka naman. Kakakain ako, ganyan. Wala akong pneumonia, wala akong chest pain, wala akong
That's good.
Meron akong kasama sa bahay na parang post-renal transplant.
Okay.
So
kailangan mong mag-isolate talaga.
I doubt kung makakabalik ako sa bahay kasi I'm just very concerned,
sa welfare ng kasama mo.
So dinala ako sa COVID ward for 3 days. Kasi 'di ba usually dito sa Ireland meron tayong hotel facilities na nag-cater ng mga COVID positive. Kinokontak nila yung facilities. Sa ward muna daw ako. Pero after 1 day or 2 days na wala na yung fever ko eh. So napagdating ko na sa hotel, parang wala na, parang normal na na lang.
So pahinga na lang. I'm happy that you were okay at hindi nag-progress talaga kasi alam mo naman yung COVID natin. We have witnessed kung how terrible it is, di ba? But I'm happy that you were well. On a lighter note, pag-usapan naman natin yung mga major adjustments mo nung nagpunta ka dito for first few months natin dito.
So siguro pinaka malaking adjustment lang siguro is yung mga patients cases. Kasi sa Pilipinas, general surgery ako doon. At saka wala akong experience sa colorectal. Meron tayong appendectomy, cholecystectomy, pero yung mga stoma formation. Kasi nagagaling lang ako sa secondary hospital sa Pilipinas. At first, overwhelmed ako sa mga cases ng patient. Dami yung ginagawa, ganyan. Even vital signs, every 1 hour, just every 15 minutes. They can output. Alam mo yun, ang laki talaga ng adjustment. Kasi iba yung, feeling ko lang, hindi ko alam sa mga ibang nurses.
I'm just curious though, how's the communication? Medyo nahirapan ka ba mag-adjust sa communication-wise? I know you can speak English well, but did you struggle, understanding them at times?
Isa din yan sa problema ko dati nung unang-unang
Lahat naman tayo ata. Lahat tayo.
Actually, we know how to speak English and then we understand English, Yung accent talaga nila kasi, mabilis silang magsalita. Tapos minsan nagtutwist pa. Alam mo yun. Tapos meron silang mga specific word kasi tayo mga parang American English tayo, diba?
Yes.
Oo. Ano daw yung ganun, parang ganun yung nagiging scenario sa word eh. Kaya pinaka-importante dyan, if you don't understand, you have to ask questions.
Yes.
Yun yung pinaka-key dyan para matuto ka. Huwag ka mayang magtanong. Kahit ginawa mo na to sa Pilipinas, kahit ginawa mo na to sa abroad, kung first time mo gagawin sa Ireland, talagang kailangan mo magtanong. Para for safety purposes lang, parang gano'n.
Exactly. And also, it doesn't make you less of a nurse kung magtatanong ka or magbe-verify ka ng mga sinabi nila.
Parang learning ko na lang din na, yung pala yung pagkakamali ko. So next time, alam mo yon, kapag talagang doubt ka sa isang bagay, you have to ask questions.
That's actually a good advice to new nurses na mag-work here. Like, do not be shy. If you were unsure about things, you have to ask. Major differences ng practice here and the Philippines. You already mentioned about the big surgery. How about the medications? Are there a lot of medications you were unfamiliar tapos pinag-aralan mo talaga?
So, meron mga medication dito na first time ko ma-experience. Yung phone ko lagi nasa pocket ko. Tapos isa-search ko, ito pala yun. Ito pala yun.
That's good.
Ito pala yun. Talagang dito sa Ireland, specifically sa hospital namin, full nursing care. From head to toe talaga, ikaw talaga yung gagawa. Kasi saka yung mga healthcare assistant, hindi nila responsibility mag-vital signs. So kung nasa Pilipinas ako, may nursing aid akong kasama, nag-vital signs, tapos tinitignan ko na lang yung vital signs. Pag start mo ng morning, vital signs ka lahat ng mga 6 patients mo. You have to
Yeah.
change the bed. You have to, parang iwa-wash mo pa yung pasyente mo. At saka pinaka-big deal dito, Raymond, you have to be careful in terms of assessment of the pressure source. Sabihin ko lang yung experience ko dati nung bago ako kasi hindi ako masyadong ganun ka-competent in terms of pressure source before. Siguro nagkailangan ako ng assessment tapos nung pagkakita ng CNM ko, talagang grade 3 na siya agad. This is not the proper documentation, sabi niya ganyan-ganyan. After nun talagang pinag-aralan ko talaga yung mga stages ng pressure sore. Sabi nga nila, kapag nag-pressure sore yung pasyente, negligent ang nurse yun.
Mm-hmm. Saka maganda din yung sinabi mo na we have sometimes some shortcomings or there are things that we really not know about. And maganda yung ginawa mo na talagang pinag-aralan mo yung pressure. So I just want to ask regarding the dealing with co-workers. Kasi alam naman natin we are here in Ireland and this is a very diverse country. So I'm pretty sure in your ward, there's a lot of other nationalities as well.
Actually, yung mga co-workers ko sa ward, okay naman sila. Kung okay yung pagkikitungo mo sa kanila, for sure, okay din naman yung pagkikitungo nila sa'yo. Join their club lang, parang gano'n. Parang kung mag-joke sila, sumali
Tawa ka na lang? Paano ko hindi natin naintindihan yung joke?
Actually, ito nga yung nakakatawa, Raymond, kasi meron isang healthcare assistant sa amin. In-approach ako last time, siguro mga 2 weeks ago, sabi niya, night duty ako noon. Tapos nag-joke siya sa akin. Sabi niya sa akin, Uy, Remos, sabi niya, alam mo, 1 year ka na dito, bakit hindi ka pa rin naano sa mga joke ko, sabi niya. Sabi ko na lang sa kanya.
Ay, niya.
Sabi ko, talaga, super busy lang talaga ako sa pero minsan talaga hindi ko talaga naintindihan yung joke nila, Raymond. Pero minsan matuto ka lang makinig, siguro.
Okay, yeah.
Communication talaga yung pinakamagandang paraan para makapag-adjust ka talaga thoroughly sa ward mo.
We are already 1 year dito sa Ireland. So how did Ireland change your life so far?
Siguro in terms of nursing, mas naging ako ngayon, mas naging productive ako as a nurse.
How about living here so far in Ireland? Are you having fun? Are you enjoying it?
I'm enjoying the weather.
Totoo. Siyempre.
Totoo.
Oo,
Pero minsan nararamdaman ko parang kailangan ko din ng araw. Balance yung yung life mo kasi nga you're just having 3 days in a week of duty. You can spend your time with your family, chatting with them, makakapagpahinga ka, then after that, back to work na naman, and then off na naman. Alam mo yun, parang parang balance lang talaga yung buhay dito.
That still have a lot of questions for you, but I think this will be our last question for this interview. Do you have any tips or any advices to our aspiring nurses? Kasi I'm sure marami ka share sa kanila.
Siguro sa mga aspiring nurses na gustong pumunta dito, dahil nga, di ba, number 1, dahil pandemic ngayon, COVID, so marami talaga mga hindrances, di ba? Pero wag lang silang mawalan ng pag-asa.
Mm-hmm.
Basta tuloy-tuloy lang nila yung application nila at saka magdasal. Kasi kahit naman sino dumadaan tayo sa mga pagsubok, di ba?
Yeah, totoo yan. And if you really have a dream, you just really need to chase it, di ba? Tama ka naman, marami mga hindrances na pagdadaanan. Oy, Remos, thank you so much for your time, ha? I really appreciate your efforts sa pagsagot ng ating mga tanong. And I'm pretty sure a lot of nurses will be learning a lot from this talk.
Continue to subscribe sa YouTube ni
thank you.
Ni Raymond kasi napaka-informative talaga ng vlog niya talaga sobra.
Thank you. Once again, Remos, thank you so much for your time. And I hope makita tayo after lockdown.
Oo, kasi hindi pa kami pumunta sa bahay, hindi eh.
Oo nga. Anyway, thank you so much and I'll see you soon. Okay guys, so this concludes our episode featuring surgical nurse as part of our series Nurse in Action. So once again, thank you so much, Remos Wally Urquico. Thank you so much for watching this video and I hope to see you again soon. Once again, my name is Raymond and if you haven't subscribed yet, please do so and please follow my Facebook page, Nurse Raymond 123. Okay guys, so I'll see you again soon. Bye!
Bye guys!